Welcome to this episode of Global Health Series. I'm Vivian Kosinje-Bradshaw, your host, and I am with two distinguished professors, Professor Will Ngwa and Professor Ahmed El-Zawawi from Egypt, or in Egypt right now. First of all, I'd like to say thank you for staying up till 10 p.m. to be with us. We appreciate that. With that, I just want to invite each of you to introduce yourselves for our viewers before we go into the topics for today.
So thank you so much, Vivian. It's wonderful to do this with Professor Ahmed. So I'm Professor Will Ngwa. I am a professor of radiation oncology and global health, also the founding director of the Global Health Catalyst, at Harvard and Johns Hopkins. And so I'm really excited. I was one of the co-authors of the book, the Win-Win book, which is really, I think that the phrase can be patented to Professor Ahmed El-Zawawi, win-win for global health. So yeah, we co-authored this book that we're going to talk about today.
Professor Ahmed?
I am Ahmed El-Zawawi. I'm professor of clinical oncology and nuclear medicine at Cairo University, Egypt. I am the founding president of ICDOC, International Campaign for Establishment and Development of Oncology Center, that was registered in USA. I am the past president of AWARTIC, African Organization for Research and Training in Cancer. And now I'm honored really to be sharing the Win-Win Scientific Initiative of the Global Health Catalyst and the board of directors of the Global Oncology University that is free tuition for all in the world and open for all in the world, including its program in different disciplines and different things, including global oncology.
Exciting to have both of you who are doing amazing work in different parts of the world, and yet you're coming together to collaborate. This is just one of the programs or the projects you've collaborated on. I know you collaborate on many more, but today we want to talk about your book, Approaching Global Oncology. Maybe to start again with Professor Will, why was it important for you to be a part of this book? And yeah, let's start there. And what is the book about?
Yeah, I mean, this is probably a good question for Professor Ahmed to start, but I can go first. I think this book is one of the, I really think, a groundbreaking book, in the emerging field of global oncology. So global health is really a young field. I mean, it's been there for a while, but as an academic field, global oncology has been emerging over the past, not so many years. Like, it's kind of a young discipline. And every time we go anywhere, we meet people who are young people and people who are really interested to be part of global oncology. And so what they'll be looking for is some kind of guide, and I think that this book provides a powerful guide. But what's really special about this book, and I think that's what inspired this, was the idea of the win-win, the win-win notion. So, if you think about PEPFAR, which is one of the biggest global health projects ever by a government, that saved 25 million lives and counting right now, by the US government, it's really viewed as foreign aid in some ways, but the approach or the notion of the win-win means that we have to approach global health in a way that it's not just foreign aid. All the people who are collaborating can win, and I think that that's fantastic, because it's actually the way that you can really have this global oncology as sustainable, because if everybody wins, then everybody's going to be invested into it. And so I thought this was really important to have such a book out there.
Yeah, thank you, Professor Ahmed.
Yes, what inspired us to do this book, that really after years, I am old man now, after years of contributing in many international organizations and international work in different and also many missions in different parts of the world, different continents. After all this, we passed by many agendas, many promises, many plans, many declarations. But in fact, what happened really, and this is reported by many, that the gap between what is required and what is available of cancer care of better value or values patient-centered care and control is widened, and it is nothing indicate that this gap will be less in the upcoming years, despite of declaration, conference, submission, commission agendas, declaration. So this inspires us to say that stop complaining all the time, stop to this tragic showing this tragic situation, but search for solution. Our role is to search for solution and not to complain all the time or to see heart something that break our hearts really of this suffering of millions of people in the world, and the numbers are increasing. No indications that will improve this gap. Despite of the improve and of care, and despite of innovations, despite the new drugs, despite of all these things, but the gap is increasing, and this even new technologies put more challenges on its affordability, and even is not only in low and middle income countries, but certain fraction now in affluent countries. United States, there are problems of skyrocketing cost of so are there solutions? Yes, there are solutions. So we are focused on constructive things, and we presented not one or two or three examples, but we presented in this book tens of published example, already scientific and already published by many others, but unfortunately are not exposed, are not used for because there are different incentives, different factors. So we say that we present this as a stimulus, as big stimulus to more and more researches by many in the world. It's not exclusive list, it's not exhaustive list, but we show that Will and I, that there are many examples already scientific, and that can lead to decrease the total cost of care, improve the care, that can lead to more collaboration and cooperation, constructive, and all will win, including industries, patients, government, economies, science, improving, going forward with science, going more progress in science. So that is what inspired us not to repeat the same complaint, because there are hundreds of articles about disparities, about lack of equality, about delay in presentation, about lack of services, about this break-hearting picture that break our heart really of human beings suffering everywhere. Right. So be constructive and positive, and giving examples that could be increased by many other colleagues. We are not saying that we are have the magic stick to solve all, but we give that, pave the way and give constructive ideas to all.
So what I'm hearing is that you're focusing on strategies to do something, action items on what could be done, and which takes me to the next question. Actually, before we even get into the next question, I'd like to invite Dr. Ngwa to please explain for our viewers, those who may not be familiar with the terms, what is oncology? And what, through that definition, it may sound simple, but through understanding it, then we'll understand the purpose for this book. And for those who might not be in the medical circle. So what is oncology, and what is in this book that is not in other books about oncology?
Yeah, oncology is quite simple. If you've heard the word cancer, so cancer is really quite familiar. Many people are familiar with cancer. So oncology is the area or discipline where, we study about cancer and what can be done, to create solutions for that. And I think that this book is really unique in the fact that it takes that and looks at it from a global perspective. So global oncology is essentially a global health in oncology or addressing cancer. And like Professor Ahmed said, really moving away from just talking about, the disparities and the dearths and the sad stories around this, but being able to present something where we are presenting solutions and win-win solutions where everybody can see how they can work together to get those wins.
Right, thank you. And which gets me to the next question for you, Dr. Ahmed. We talked about the win-win solutions that are in this book. But when you were coming up with this book, what was your audience? Who do you want to read this book? And what do you want them to take away from this book?
Yes, all who are concerned with the problem of affordability and access of better value, good quality scientific care in the world. This includes, surely, this by definition, oncology, the science of cancer care. So by definition, it is all practitioners, all the cancer care providers, because cancer care provider is not one specialty. There are many specialties, multimodality specialties, who serve the cause of cancer care and serve the patient in such these things. So all cancer care professionals, all postgraduate surely, but also all stakeholders, including industry, including researcher, including policymaker, economists, because there is a lot of economies, because this is the key of everything. So it is all who are concerned about cancer care and the scientific progress in cancer care.
And of course, as somebody who comes from sub-Saharan Africa, I have to throw in this question, what are some of the practical win-win model or situations or examples that are in this book that could be adopted by oncologists and also other stakeholders in the region to bridge this disparity, because we know cancer is a huge burden on the continent.
Yeah, I think I'll let Professor Ahmed answer that, but I want to add something to what he said about who is the audience. I think we know that global health is multidisciplinary, so it's very cross-disciplinary. Everybody is a stakeholder in this, everybody, including you, Vivian, even in journalism or media, everybody knows somebody or has experienced cancer, right? You know somebody who's had cancer, or you in your family, most people have experienced cancer. So, and cancer also is not only about the healthcare aspect, because it's a pandemic. Don't take my word for it. Take the recent statistics from the World Health Organization, where, close to 20 million cancer cases a year, 10 million deaths. So take my word for it that it's not just a healthcare problem it's a pandemic, but it also has an economic impact that affects everybody. So everybody's a stakeholder in this. And I think that's one of the unique aspects of this book, is that it's very accessible. Everybody who reads it can probably find an area where they can contribute.
That's fantastic to hear. Back to you, Dr. Ahmed.
I agree completely with Will in that all are concerned with this problem. I would like to add that we concentrate on solutions, we concentrate on scientific work, but also we show many examples of collaboration and cooperation, successful, really examples of collaboration that brings more services to countries like in sub-Saharan Africa, in Latin America, in others. We give to East Europe and others. So we are giving this example of collaboration. This is between North and South, and South and South also. So there is, and how this could be adapted for the real condition in people in, never mind in Alaska or in sub-Saharan Africa, but it is adapted to them. But this is very important if we say value-centered care. Just today, I don't like to say many details, but just today we have a session about maybe it is new technologies, and apparently it is something very technical, but because it's our job. But how these techniques could give solutions for countries in sub-Saharan Africa or other countries where the problem of interruption of electricity and or inefficiency in some part of Latin South Asia, and some that prevent, because if we speak about linear accelerator radiotherapy, linear accelerator is machine for radiotherapy, or using radiation in treatment of cancer, or other things that need electricity and need sustainable imaging, or this need sustainable electricity. So one of the solutions was we presented today the example presented by two of our colleagues in Germany about solar power radiotherapy. Another example of that problem of indication of cervical carcinoma and something that because this needs some isotopes, something that need license, something that be complicated, something that machine. But we presented also example of something that could be portable without risk of contamination because of these radioactive materials, and could be transported from, it could be from one city to another by event or something, and you have the list of patients. So you don't need to build big buildings in Africa or invest a lot, and the same machine can treat patients in 4, 5, 6 regions, and it is just transported by van, and it is very, very robust. So there are many solutions that can give very scientific outcome, lower the cost, and be adapted to the real condition that we don't expect that it will be solved tomorrow. If we say wait till the electricity become good in Africa, so yes, it will improve one day. But all these patients now, what they can do?
Yeah, no, that you bring a fantastic, point that we can't wait for, the full development to happen before we take action. One question I have for each of you is, when during the process of writing this book, like what statistics shocked you? And because through this process, there's a lot of research, there's a lot of talking to stakeholders. So what shocked you? What information or data shocked you?
Yeah, I'll take the opportunity. I'll take the opportunity to talk about that, but also add some additional examples of win-win solutions that also are connected to my work. So, in terms of statistics, one of the key things that shocks me is that, talking about radiotherapy, the example of radiotherapy, which Professor Ahmed has just talked about, that we have a type of radiation therapy approach that's called hypofractionation, which means that patients come in and they can come in fewer times. So for a prostate cancer patient, for example, instead of coming in 35 to 40 times, they only need to come in, 5 to 7 times. So it means that the time it takes to treat one patient, you can treat 5 or 7 of them, right? And this approach is something that can really, really increase access to care for patients. But what shocked me was that across Africa, this is poorly adopted. And this is not just Africa, also in low and middle income countries, and even for minority populations in the United States, right? So this approach is not being adopted. And the question becomes, from knowledge to doing. So we may have these scientific approaches that we know that work, but then the implementation of that is a problem. People are not implementing them. And I think that's a wonderful aspect of the course that Professor Ahmed is currently leading now on the Global Oncology University, really focused on implementation, which makes us ask the question, why are we not adopting these approaches that can tremendously increase access to care and are based on science, right? And I talked about prostate cancer, but you can go across other cancers. Breast.
Do you have an answer to that question? Why aren't we taking them up?
Well, yeah, so one of it is the implementation. So there are barriers that we are identifying, which we actually have published some of that. One is just educating people about these approaches, right? So you just training the doctors, building their capacity, letting patients know that you can take a increased amount of radiation dose. It will not kill you. I mean, just educating people about this is one of the barriers, right? Another one is just, cultural barriers. We see that, Some places, they just have, they have the cultures don't really permit people to access care the way that, you would expect them to do. For example, in some institutions, just looking at the culture of safety in radiation, people, which has to come from the top, people don't really institute that culture. And so the implementation of that can be an issue. But I think the implementation science course that's going on now is a good example of how you can, a solution where you can educate people about some of these evidence-based approaches that they can adopt that can really help address these disparities. A second example, which I'm very excited about, that's coming up, is really from my own work and building on the work that I've done at Harvard and Johns Hopkins, which is really low-cost immunotherapy. So if you look at the statistics, they are stunning that in low and middle-income countries, people don't have access to immunotherapy because obviously even in high-income countries like the US, the cost of immunotherapy is about $100,000 per year for patients, right? So, think about a lot of the disparities in the United States, and also now in lower middle-income countries that cannot afford this. So being able to create scientific approaches that can increase access will benefit not just United States or just these lower middle-income countries, but can also benefit United States. And I think that that's where the win-win becomes really clear, where you invest into solutions that can benefit both high-income countries and lower middle-income countries. Everybody wins, like Professor Ahmed said.
Thank you, Professor Ahmed. What are some of the shocks from the process of writing the book?
Not shock, but what is the tragic numbers and statistics I know from before, and this is because this is the big motivation to me and to my colleagues to share this and we didn't start from yesterday, but this is always in front of us. But what shocked me is that is the presence of more and more constructive solution, and we don't use. Speaking about skyrocketing drugs, rise of price of drugs even in the United States, and we discover that some drugs, from the scientific point of view, you can use 1/4 and 1/5 of the dose, giving good results, and in the same time with less side effect, and 1/5 or 1/4 of the price. The more shocking examples that I cited in the book, I didn't invent anything, by the way, all of with references. We are not inventor. This is present. This is what's shocking, that it is already present, that cost of course of treatment of new drugs cost about $100,000 US, but how we can reduce it to the real cost and the benefit without compromise the benefit, no, but even to have more benefit and less side effect, to $4,000. You imagine from $100,000 to $4,000. It is all this is stated, and there are many things even to revisit. The trials, the clinical trials, happened since years, and it was approved before by FDA and others, and we discovered, written by many professors in the States, but nobody, I don't know why, to take care of this, that it is the dose that we started with in phase 1 was more, particularly immunotherapy, much more than it should be used. So the trial itself, all clinical trials after, based on phase 1, phase 2, phase 3 trials, was not point of view the science of drugs, and from the regulation even of FDA and others. So this should be revisited and should be discussed. And there are a lot of waste. I see just one example, shocking example. The leftover in some vials and ampoules of some drugs in USA, cancer drug, it is equal to $3 billion a year. This is in United States only. Say left over, and there is no solution for this. No, there is many solutions. Very simple, dividing, making vials less less size of vials, many things to do. But you waste $3 billion for just a leftover that go to waste, and we say after there is no resources, there is no there is lack of resources, how we mobilize the resources. And the shocking thing also that in Africa, in South Asia, and there are resources not used and not utilized. I see that Africa is limited, poor countries, and need help. Countries have the curse of having resources, a lot of resources, but the West have the problem that many waste. So the question is how to use our resources, our knowledge, the knowledge of all these discoveries for the benefit of human beings, and not for its harm.
Right. So one way of doing that is through the book. You guys have collected all this knowledge and put it in a book, which is amazing. It's one of the most effective ways of sharing information and sharing. That's a resource there. With that said, getting back to the book, where can people access this book? And maybe let's first start there, because the last question that I'll have for each of you is, what message do you have for our viewers regarding this global oncology, approaching global oncology and that whole win-win model? I don't know who wants to start.
Yeah, I'll let Professor Ahmed answer about the book, but I wanted to add additionally one area that we cannot ignore. That's really a win-win area that's emerged, and that's artificial intelligence and technology. This is going to transform global health. We know that. Every single day you get up and you're surprised about what, the technologies the capacity of this technology in increasing access to care, empowering patients. There's just a lot of opportunities here. And in this book, we already start talking about that. And one of the courses coming up, we plan to have a session around the use of technology. And I think that that's something that is going to transform global health. The win-win there, obviously, is that if you do that with the data, and that's something where the Cancer Monitor in the White House is really interested in investing in technology and data sharing. AI, really, the currency for that is data. So if you want to train that, you need every population involved who's going to benefit from that. So not only US populations, you need low and mid-income country populations and high-income country populations together, everybody. And so when you develop that solution, it becomes a win-win for everybody. I really want to mention that because it's a big area coming.
It's just a reminder before Professor Ahmed that I think we'll need a whole session, whole interview on just AI, because that's a huge monster that I have so many questions that I cannot ask in this particular interview, including who trains these models, especially for sub-Saharan Africa. And that's something that the Cancer Moonshot needs to invest in. But to Dr. Ahmed, but thanks for pointing it out. Professor Ahmed, your message to the viewers, and also, where can the book be accessed?
First of all, the book we can provide you and can send to you the links to Amazon and link to IOP, Institute of Physics publication, and also the first chapter and front matters, which includes the summary of the whole book, is free of charge online. And many of the updates of this book are present now in courses of the Global Oncology University, Global Oncology Implementing Science. And this is all is now in videos, and we can send a link to all the stations, that's based essentially on this book, but with updates also. And it is available free of charge, and accessible to all. That's I can send you the playlist of to listen all colleagues in the world. So when we say the all colleagues in the world, this is the message that this initiative will be successful only if it is adopted by many, led by many. Everyone feels that his initiative, add to it, modify, improve, is not, we don't say that it's fixed or no, flexibility of of thoughts and free flow of ideas. So my message is our message is to that everyone, every viewer to this video, every reader to the book, everyone who watched our courses or please feel that is yours. We are together, and be ambassador to this, spread the message and to improve to it and to add to it. No problem. The challenge is too big and needs all of us.
Yes, we shall spread the message. And that is a great way for me to say it's been such an honor to host the both of you as distinguished professors. Professor Ahmed, you're doing an incredible job with the implementation science course, which I've had the honor of sitting in a few times. Professor Will, thank you for the vision. You're doing amazing work with all the GHC projects that are going on. And together, you are all, and all stakeholders are doing immense work to bridge these disparities, because I see it in some of the meetings that I sit in, seeing the collaboration with other stakeholders in the region, in sub-Saharan Africa. That's what it takes to make an impact, to actually work with the people who are on the ground. So I am so proud and I'm so honored to have this conversation with you. And yes, we'll spread the word about the book, and you can count on us always to continue spreading the word. Thank you again. Asante sana. Thanks again.
Thank you.
Thank you.
And to our viewers, thank you.
And hand in hand. Hand in hand.
And to our viewers, thank you for watching this series, this episode of Global Health series. Till next time.